Hello, everybody. Thank you for joining us. This is CLS Live. It's a live stream series presented by the publishers of Contact Lens Spectrum. My name is Philip Morgan, and as you might be able to tell from the dimly lit conditions outside my window, I'm talking from you in the late afternoon here in Manchester in the UK. Good afternoon also anybody joining us from across Europe, and if you're joining us from North America, a very good morning to you. Last month on this series, I talked with Dr. Jason Jedlicka about the situation of contact lens prescribing across the United States. And this month, as part of this mini series, we're going to be looking at the situation here in Europe. Now, of course, if you just look at in population terms, at least if we think about the European Union, the 27 countries of the European Union, there's a similar population between the EU 27 and the United States, but we see a much greater variation in contact lens practice, however we might wish to define that term. And so we're going to be exploring that today. The situation in Europe is very interesting, not least for who actually prescribes contact lenses. As we move east across Europe, we see ophthalmologists are the eye care professionals responsible for prescribing contact lenses in the main. As we move west and perhaps north, it's more of an optometric pursuit, with opticians also playing a role in some countries. A notable exception to this rule is in France. Well, today, to explore this, I'm joined by two fantastic guests, really representing two quite different European markets. First of all, I want to introduce Associate Professor Anne Elizabeth Easternes. Hello, Anne. Thanks for joining us today. Anne is an optometrist who works at the Department of Optometry at the University of Southeastern Norway in Kongsberg, where she works at Norway's only optometry school. So good afternoon, Anne.
Good afternoon.
Yeah, thanks for joining us. But first, though, I'm going to turn to our other guest this afternoon. She is Professor Christina Grutscheva. Christina is an ophthalmologist, very well known for those of us on the European contact lens scene and circuit, and she joins us today from her hometown of Varna on the Black Sea, where she's head of the Department of Ophthalmology and Vision Sciences at the Medical University of Varna. So good afternoon to you, Christina. More like good evening to you, really.
Yeah, good evening to you, Phil. Thank you very much for this kind introduction.
Well, Christina, my first question is to you. What I'm doing in this series, I'm looking at how people actually can get contact lenses. Let's suppose I'm a 20-year-old straightforward myope. I'm living in Varna and I want to get contact lenses. How would I go about doing that?
Well, there are many different ways to skin the cat, as you like to say in UK. And basically, it depends very much on the approach of this young person, because if they're happy to have a private consultation, they can have it straightforward from a contact lens practitioner, which can be optometrist, but more likely is to be an ophthalmologist. And they can have lots of advice, thorough examination, and get their contact lenses. If they, however, want to save some money, they can go via the health insurance system. And that means a little bit of waiting, 2 to 3 months. And after that, they can get to an eye doctor, and they may decide not to prescribe them contact lenses, and they may try to convince them that glasses are better for them. There is, of course, a third option when they straightforward decide that they help themselves and order contact lenses, and after that, we see those patients in the emergency department. So usually patients are choosing the first option, but sometimes they choose the second option first, and after that they go to the first option because they were told that contact lenses are not for them.
Yeah, that's really, really fascinating. So you mentioned perhaps a minority might be prescribed by optometrists. Is that a new thing in Bulgaria, or has there always been a sort of a small proportion of contact lenses prescribed by optometrists, or is that growing for some reason?
No, it's an absolutely new thing in Bulgaria. So it was a fight, actually my personal fight, for about 12 years, and I created the specialties. Actually, our university is a pioneer in medical optician specialty, and after that we upgraded it to optometry. So currently there are 2 more universities that are producing optometrists, but we are the only medical university that produces first of all medical opticians, and after that optometrists as well. So next year we are going to have a 10th year anniversary for the medical opticians, and in 1 year we are going to have a 5-year university for the optometry specialty as well.
Well, I know you've been really pioneering with your work in optometry training in Bulgaria, so that's great to hear that, Christina. Let's hear from you. I'm still this same simple, straightforward myope. I'm living in Kongsberg, there in southern Norway. How would I get contact lenses in the way you practice?
You will in Norway it's only optometrists fitting contact lenses. So and here in Kongsberg we have 8 optometry stores, and we have the university clinic fitting contact lenses. So you will probably go to one of the stores or book appointment here in the university. It's also possible to buy over the internet, and some people probably do without having any consultation first.
Is that legal? Is that quite straightforward and legal, or is it technically illegal to buy lenses over the internet?
I think you can buy over the internet if you, but then you take the responsibility yourself. But if you buy through an optometrist or a healthcare professional, then we will have to be responsible for fitting and for advice and for information, patient instruction.
Okay, so perhaps the internet having some part of the market in Norway. How about with you, Christina, in Bulgaria? Is internet supply? I mean, you hinted at this before. Is internet supply an issue for getting contact lenses in Bulgaria?
There is a supply, but it's not an issue. At the beginning, it was a big issue because everybody was scared that something is going wrong. But after that, via education, lots of my peers realized that if you put your prices to the consultation, not to the margin of the contact lenses, actually you can be very competitive to internet, and patient, even if they need to pay a little bit more, are more happy to buy at the optical shops because they have more responsibility there. Basically, they know from whom they buy the lenses. If they have problems, they can consult this person. And I think that in Bulgaria, there are pretty much patients that are attached to a certain shop and even to a certain consultant there. So I think that the adherence, as far as patient decides that they're going to be a contact lens wearer, they are happy to adhere to a practice. Actually, at the practice that I give my consultations, we observe exactly the same. I encourage them to purchase the lenses wherever they want, but they prefer to have the responsibility of the practice, and maybe 2/3 of them are ordering their lenses at the practice.
Okay, well, that's interesting. Let's take a look now at the sorts of lenses which are prescribed in your 2 markets. We're going to start with Norway on. Something that stood out to me for many years is the high rate of daily and disposable prescribing. Even 20 years ago, when we were doing our surveys, it was over 40% of soft lens fits, maybe 60% today. So they took off very quickly. And even though some markets may now have caught up, why do you think they were always a popular option in Norway, Ann?
I think it's probably several explanations to that. First, economy is good, so it's affordable for lots of people. It's very convenient and it's safe. So I think all these aspects makes it easy to communicate all the advantages to the patients. So I think it's very I think it's a very good solution, and the patients easily understand the arguments for it. But also we have a very long history of frequent or planned replacement. I started back in early 80s with planned replacement lenses. Bausch & Lomb was very big in Norway at that time, and they were very early with the 1 year replacement, 9 months, 6 months, and then down to monthly replacement. So it wasn't so long way to go to daily disposables.
Yeah.
And we have heard that daily disposable would be very good advantage for patients because of the safety and everything. Microbiology. No, you have sterile lenses every day.
Yeah.
It should be a very safe wearing modality.
Yeah.
So
yeah, a long-term use of daily disposables. I guess another standout characteristic of the Norwegian market is this really very high level, relatively to other countries, of extended wear prescribing. Maybe 15 or 20% of soft lens fits in Norway are extended wear. This is 2 or 3 times the global average. You see,
yeah.
why might that be on?
I think it's we have heard all these lenses several years before it was available on the market. We have heard, so we had expectations to the products. We expected them to be good. We have heard it was heard about all these studies saying the lenses were pretty safe, few complications. So I think we had high expectations. And I think also we were interested in having something new. We were interested in the topic in some ways, and it was debated a lot on conferences when optometrists met. It was a lot of discussions about the lenses and that sort of lens wear. So I think to be in the discussion, you must fit a lot of those lenses.
Yes.
Yeah.
And I guess with there only being one optometry school and all optometrists going through the department in Kongsberg, maybe, I guess, potential for a lot of influence from the people teaching contact lenses there as part of the curriculum. So that's interesting. Okay,
I think that's a very important aspect as well, because we very early did a study on the extended wear contact lenses and talked a lot of the study when we did the education. So students heard of the progress of the products and studies and complications and everything. So I think it was we might have influenced fitting, but it looks like it goes slightly down at the moment.
Maybe, but still a good sort of case study of the sort of influence of a teaching institution on local practice. Well, over to Christina now to talk about the situation in Denmark. One contrast that I would see from the data, Christina, and that you've worked with us on for many years now, is perhaps a much lower rate of daily disposable prescribing, maybe 10% of soft lens fits or something like that. Any thoughts why that might be? Very interesting to get your insight in this.
Thank you for this question. Actually, this is a big problem for myself, because I think that it's an inherent problem, which is a more cultural thing. Bulgarian prescribers somehow are afraid to take the decision for the patient to put them into the position to purchase something which is more expensive. And because of this, they give them a choice, not just saying them that this is better alternative and I recommend you exactly this. I think that this is one of the reasons. The second reason, of course, is the economical situation here. The health insurance system never reimbursed any kind of contact lenses regardless, and children have to pay, their parents have to pay for their lenses as well. So basically, patient pays out of their pockets, and they try, especially now when the economical situation is not so good, they try to save some money, and I think that they try to save from themselves, and this happens as well. Another possible reason might be that basically patients try to read a variety of different information sources, and some of them, I talk to some patients, some of them are getting wrong information out of the sources. I've been having conversations with more than one, I think more like 10 patients that were telling me that they were reading Nathan Ephron's paper, and because they were reading this paper, they realized that if they wear their lenses every day, it's better for them. So basically, the paper does not say anything like this. So this is just an example how they got a wrong message out of reading something which is not targeting their audience. So I think that this is very important thing. They should read the brochures, consult specialists, but not try to outsmart the system and go to the source, which is out of their competence. So I think that this is something that happens here and happens in entire Eastern Europe, because lots of my colleagues are sharing similar thoughts.
Okay. Perhaps one final particular comment on the Bulgarian market, Christina, is an observation I've seen over many years is a relatively low rate of toric lens prescribing. You know, many parts of the world, in about 40 or 50% of prescribed lens pairs, at least one and maybe two of the lenses will be a toric product. In some markets, it's much lower. It seems to be about 15% in Bulgaria. It's similarly low in some other markets like Japan, which are also ophthalmology dominated. I don't know if that's a coincidence or if that's an ophthalmology thing. What are your thoughts on that?
I have lots of thoughts on that, because I'm trying
Well,
to. This is a historical.
We probably only have time for about 1 minute's worth of thoughts for Christina,
Okay,
if possible.
so this is a historical problem, Phil, because in the past, when I was trained, we were doing a spherical equivalent for glasses as well. And I was one of the first one to push toric lenses for glasses, because I was believing in correcting astigmatism. Lots of older ophthalmologists are still prescribing contact lenses in Bulgaria. And I think that this is the reason they do not believe in toric lenses. And they still have big amount of patients. So the newer generation is different. But also the response of the older generation, when you send them the survey, is much more precise. The newer generation sort of do not have time for it. So I think that the result may be a little bit skewed by this as well, because older population and older generation is a little bit less prone to prescribe toric lenses.
Right, okay. And that's really interesting. And again, harks back, we talked about the influence of education with one of Arn's answers in extended wear in that sense. And again, it just shows it's sort of logical to be some degree of influence, but it's coming through on a couple of examples here about the influence of what we're taught, how we're trained, and ultimately what that means for the products we prescribe. Okay, I'm going to move to our final question, something I'm asking everybody in this series. And I will turn to you first for this final question. What aspect of contact lens practice do you think is important, but perhaps does not receive enough attention?
Well, there are several aspects actually, but I'm thinking of ethical aspects related to myopia treatment. Mm-hmm. Because I think it's very important that they are doing it properly. So if they want to fit contact lenses to arrest myopia, they should do axial length measurements, they should do cycloplegics, all those things. And if optometrists or people don't have access to those instrumentation or drops, they shouldn't actually do it. Okay. So I think that might be under-communicated in some ways, at least from manufacturers.
Yeah. Okay. So, I think there's certainly a lot of discussion at the moment about these sorts of measures in myopia management. I guess some people feel, certainly people who've done this a lot have done it for many years without some of these measurements. So it's a certainly really interesting discussion point. So thanks for that. I'll turn Christina perhaps to you for this final question on, yes, what do you feel is important, but perhaps we don't talk about enough?
Presbyopia and accommodative lenses. I think that currently presbyopia correction is a compromise. And I think that the efforts of the industry and also the practitioners should be in this direction. And hopefully some IT companies may help, because adaptive optics may help for this issue. So I think that presbyopia need to be more addressed.
Great, fantastic. I'm going to bring us to a close. Really interesting comments today on the relationship, perhaps, of economics and daily disposable prescribing. On mentioned that one reason maybe daily disposable prescribing in Norway is very high is the local economic situation. Christina hinted at that too. And I think we've also heard about the importance and influence of education on what sort of products are prescribed. So I think that's been a very stimulating discussion. So thanks very much then to Associate Professor Anne-Elisabeth Easternes and Professor Christina Grutscheva. We're going to move around the world in this series, and I hope that everybody's watching maybe just hears something, a little bit of a nugget from somewhere else in the world that might help you go on and remember all the benefits of contact lenses and bring them to even more of your patients. Next month, we're going to be focusing on Asia and what's happening across Asia. Again, very different set of issues and different ways of prescribing lenses and fundamentally different markets. So we'll do that in November. Please look out for earlier episodes of the CLS Live series on the Contact Lens Spectrum page on Facebook or at clspectrum.com. Now, transcripts of each show are now printed in Spectrum each month, and I look forward to joining with you again in November as we take forward this short series on global contact lens prescribing. Thank you very much, and I look forward to seeing you then.